As people across the nation are asked to stay home to slow the spread of coronavirus, many are turning to telemedicine services to communicate with medical professionals. Steve?
Well, Sam, our Ray Preston is following that telemedicine trend. He begins our team coverage of the coronavirus outbreak live in South St. Louis.
Well, even people who grew up without computers, smartphones, tablets are now starting to embrace the technology. So we asked Dr. Jason Hand with Mercy to describe for us a visit with a doctor using telemedicine.
The medical assistant makes sure that 10 minutes before the visit, their technology is working, and if it's not working, we troubleshoot what's happening. And then I will join the patient into the room after the medical assistant has left, and then we'll complete their visit.
Dr. Jason Hand says he continues to go to his office each day at the doctor's building at Mercy Hospital, St. Louis. While physicians are still seeing some patients in person, Hand says for him, 3/4 of the appointments in a typical day are telemedicine.
I can't do the classic physical exam, but I can evaluate their diabetes, their blood pressure, if they have a cough. I can evaluate how their breathing is going if they have COPD. I can evaluate their depression and their anxiety. A lot of the sort of classic things that are getting worse in this COVID crisis.
If a blood or urine sample is needed, the patient goes to a clinic location.
You're asked why you're coming in, and your temperature is checked. You're asked a series of questions around exposures and do you have symptoms. And if you have symptoms, of course, you can still come in, but we take extra care to make sure that you're not exposing other people.
Now, when Hand says that 75% of the patients he sees these days are by using telemedicine, compare that to late February when he says 100% of the patients he would visit with would be in his office. Reporting live in South St. Louis, Ray Preston, News 4.